Thank you for your comment, and thank you for sharing your experience of what it was like to be in an inpatient psychiatric hospital. I know that can be a stressful, difficult, and sensitive situations at times, and many people are not often open or willing to talk about it, so I appreciate your comment. Although there are a few things I just want to sort of clarify to help maybe shed light on what your experience was like. First of all, in patient psychiatry, a lot of times the patients are there against their will, and the patients that are there don't believe that they need help or don't think they need help. And so there is a conflict oftentimes between the doctors and nurses and then the patients, because doctors or nurses are trying to help and treat the patients, but the patients are there that don't think or understand that they need really the help to begin with. That's just a general rule of thumb. Oftentimes there are exceptions, but whenever it gets to treatment over objection, that's probably the scenario where someone is felt they're really sick enough and the court suggests that they need to be treated against their will in order to safely return to the community. And so that is often the goal of the inpatient psychiatry, is safety for the patient and safety for people around them as well. You mentioned you were diagnosed with schizophrenia, even though all you suffered from at the time was meth-induced psychosis. That could very well be true for a variety of reasons. Well, meth can cause psychosis. In the hospital setting, in order for insurance companies to pay for the hospitalization, they need to have a more severe diagnosis, such as depression, bipolar, anxiety, or schizophrenia. If someone is diagnosed with a meth-induced psychosis, the insurance company may not be paid for it, and doctors can't really let people who are in a psychotic state, if they're at harm to themselves or others, be in the community, or else they'll be liable. And it's kind of a sticky process, and I know it can sound like unethical at times, but well, maybe the unethical part starts with the insurance companies choosing what to pay or what not to pay. But in short, doctors and nurses need to get paid for the work and their service, and one of the ways is to diagnose schizophrenia compared to diagnosing meth-induced psychosis. But unfortunately, many people in an inpatient psychiatric unit are diagnosed inaccurately in order to appease the insurance companies and the payment processes. So if there's a question about the diagnosis, it could be important to talk with a doctor regularly, maybe like an outpatient doctor once a month or once every few weeks or so, and help to clarify the diagnosis. Alongside that, you also want to have a period of sobriety, no meth, no alcohol, no cannabis, to help ensure that what you're really being diagnosed with is accurate, because these drugs, unfortunately, are very powerful, can affect the mind, can affect the body, and can affect or cause mental health problems in individuals. So Invega in particular is a medication that's used to treat the psychosis part. It's not there to really treat the depression. So the depression will probably involve a different sort of treatment, which is going to be different than the Invega. So you're right in that Invega can cause several possible side effects, including weight gain, movements, stuff like that. But thank you for sharing your experience. I know it can be very stressful. It can be unpleasant. If it was all due to meth, then try to not use meth if possible. Usually the best ways to be sober are having community supports like Celebrate Recovery, there's Alcoholics Anonymous or Narcotics Anonymous, things like that to help with sobriety if anyone's having a difficult time to be sober. And then there can be sometimes underlying mental health issues such as depression or anxiety, which people self-medicate for, and so you could get those things treated through a mental health provider or clinician.